hosted by the Mental Health Commission of Canada and moderated by me, Professor Akwasi Owusu-Bempah. The focus of today's discussion is to highlight the gaps in cannabis and mental health research, education, and policy that's culturally relevant for Black communities. I'm a professor at the University of Toronto who does work in the area of race, crime, and criminal justice. And I focus a lot of my attention on issues related to drugs and drug law enforcement. And as anyone who's peeked into the world that I work in knows, you cannot study drugs, you cannot study race and justice issues without looking at the impact of cannabis. Under Prohibition, it was the most commonly used illicit substance in the country and continues to be used at a relatively high rate across our population. And it has had a number of consequences as such. Its criminalized and stigmatized status undoubtedly has impacted the ability of people to, for example, seek help for mental health related problems associated with cannabis, as was discussed in some of the earlier work that the Commission undertook and that I engaged in the Commission, or with the Commission in. I have had the great pleasure, in addition to the work that I do at the University of Toronto and being involved in a variety of different advocacy efforts, including sitting as the Director of Research for the Campaign for Cannabis Amnesty. And through that work, I have had the great pleasure of meeting almost everybody or everybody on this panel today. Now, before we fully begin, I want to acknowledge first and foremost that the land that the Mental Health Commission of Canada is located on in Ottawa is the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. As those who are participating today are located across Canada, we invite participants to acknowledge the territory you're joining us from today in the chat box, if you would like. I acknowledge, coming to you from my office at the University of Toronto, that our campus at St. George for thousands of years has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity, and I'm grateful to have the opportunity to work on this land. I just want to talk to a couple of technical details. We're pleased to be offering this panel in both official languages, which means, given the fact that I'm about 3 or 4 coffees deep on the day, I should probably slow down to give our interpreters and our translators a little more room to maneuver and do the great work that they do. The webinar is presented in English with simultaneous interpretation into French. To listen in French, click on the live interpretation button at the bottom of your screen and select French as your preferred language. Please note that live captioning will also be available in French as well as in English. So today's discussion features 5 panelists and will be centered around 3 discussion questions based on research, education, and policy. There will be a brief question and answer period at the end, and we encourage you to type your questions for the panelists into the Q&A box as the panel progresses. I'd also like to note that we're fortunate to have a live graphic video recorder from ThinkLink Graphics, Lisa, who will be capturing our ideas. And perhaps you can see Lisa at work already. I can, and I'm going to do my best not to be distracted as I attempt to moderate, because I find what Lisa does to be so neat. But we will have a small, a short 5-minute break halfway through the session where we spotlight Lisa's work. The end product will be shared on the MHCC's website, along with the recording of this panel. So stay tuned. If you happen to run into any technical difficulties, please use the chat box and our facilitator will help you out. So about our panel and the work upon which it is based, in 2018, the Mental Health Commission of Canada received funding from Health Canada to explore the relationship between cannabis and mental health. And as part of this work, between December 2020 and April 2021, the Commission, along with me, hosted a series of virtual dialogues with researchers, community organizations, service providers, and people with lived experience within Canada's Black communities. The Mental Health Commission of Canada recognizes the disproportionate impacts that the criminalization of cannabis and other substances has had on racialized people in Canada, particularly on members of Indigenous and Black communities in the country. And while identifying knowledge and research gaps, the dialogues gave participants the opportunity to share their perspectives and their experiences. From these discussions, the Mental Health Commission of Canada released a report, Amplifying Black Experiences in Cannabis and Mental Health Research, to better understand what we heard during these engagement sessions and to set the direction for future research investments and priorities. For those of you who have not had the opportunity yet to engage with the report, I encourage you most certainly to do so. So building off the momentum of the dialogue series, the event aims today to highlight the gap in cannabis and mental health research, education, and policy that's culturally relevant for Black communities. This panel will take a deeper dive, into the key takeaways and recommendations from the report with insight from notable contributors and experts with lived and living experience. And our discussion will be centered around the three domains of research, education, and policy. So again, I think that we're very fortunate to be here today and to have the wonderful panelists that we have with us. Again, as someone who's been working in this area now for quite some time, I have had the great pleasure to have worked with or engaged with at least a little bit each of our panelists. And I would like to turn things over to folks so they can have an opportunity to introduce themselves. So I'm going to just choose who's immediately in front of me on the screen. And so if I can ask first, please, Ashley Athill, if you could please introduce yourself, provide us a little bit of a description or an overview of who you are and the work that you do and what brings you to this conversation today.
Thank you kindly for that introduction. My name is Ashley Athill, and I'm the CEO and co-founder of Harvester Cannabis. We are a micro-cultivation and micro-processing facility located in Ontario. I have a great passion for mental health. I've worked in the corporate mental health space for over 10 plus years. Our focus is more so on corporate mental health, but this aligns with my previous past and as well my current, my current future and the future moving forward. So I am honored to be a part of this conversation. I'm looking forward to learning, and I'm also looking forward to participating in this very, very important topic.
Ashley, thank you very much. Ike, if I can ask you please to introduce yourself.
Hi, good afternoon, everyone. So I just wanted to do my own land acknowledgement. So I am located on the Territory and Treaty 13 lands of the Mississaugas of the Credit First Nations in Vaughan. So my name is Ike Washington. I work in this space. I'm the founder of DiversityTalk. DiversityTalk is a platform and a consultancy that will be focusing on DEI, so diversity, equity, inclusion, as well as anti-racism work within the cannabis space. In terms of background, I'm a public health professional and consultant. I've been working with Indigenous and Black communities and specializing in pandemic recovery stuff. And as well, my connection to the cannabis space, other than the professional work I do, is that I'm a medical patient as well. Someone who has been using cannabis and has honestly had a life-changing experience throughout this entire process. So my work is very much more passionate in terms of health equity, social equity, and me being a patient and knowing the blessing it has on my life. So thank you for having me.
I can thank you very much. Esther, if I can ask you please to introduce yourself.
Hello, everyone. My name is Esther Fabola. I am located on the unceded Algonquin Anishinaabe territory. I am a peer leader at Get Sensible campaign under the Canadian Students for Sensible Drug Policy. I'm also the founder and executive director of Project Agape, which is a Black-led organization that I've created in order to educate on gender-based violence and support mental health in survivors of gender-based violence. So this conversation is important to me because I am also someone who has used cannabis throughout pretty much my entire life and seen how it's benefited me as a survivor of gender-based violence and created spaces where individuals who also love to converse about mental health and cannabis and who have that experience have those conversations. So it's important to be able to have this conversation. I'm really grateful to be here. But yeah, that's pretty much me.
Esther, thank you very much. Khadisha, I'll come to you next, please.
Thank you. Hi, everyone. I'm Karisa Thornhill, and I'm coming to you from the land of the Mississauga of Scugog and in Whitby. And it's a pleasure to be here. I am founder of the Afro Canada Budsistas, which is an organization that's dedicated to educating and enlightening and entertaining our members about cannabis, through all kinds of different methods and theme days, as well as in-person and virtual events. Why this topic is even more personal to me is because the pandemic has really put a focus on supporting our mental health needs. So one of the ways we do that, for example, is we have a weekly Budsistas mental health check-in where we've been staying connected virtually with members from across Canada and the US as well. So it's great to be here because the need for education, cannabis literacy throughout our community in particular, our communities is really important. And so I'm really happy to be here and looking forward to our great discussion today. Thanks.
Khadisha, thank you very much. And last but not least, certainly, George, if I can ask you please to introduce yourself and tell us a little bit about the work that you do.
Oh, thanks. Thanks ever so much. I'm here in Tiny Township, Ontario, the traditional territories of Anishinaabe people, which I misspelled in the chat, and I feel terrible, and I'll get better at that. So thank you for the correction that was noted. This is now represented by the Chippewa Tribal Council, the Beausoleil Island, Christian Island, and Rama First Nations. I really consider it a privilege to have been invited to participate today. In my current role, I'm the president and CEO of the Cannabis Council of Canada. That means I work for Ashley. She's a board member of mine amongst other license holders under the Cannabis Act. We do our best to advocate on behalf of the industry and the sector, and we try to be mindful of our obligations to the broader cannabis community. This is how I came to meet Akwasi and others. I want to say that my own history with drug use and with cannabis offers at least two insights. The first is a candid acknowledgement that my white male privilege meant that all of my use of cannabis and harder drugs too over an extended period of time meant no criminal intervention at all, no threat of it, to the best of my knowledge. And also that I would, and have written in my memoir, Unconventional Candor, about cannabis as an off-ramp drug for me in managing opioid use. So this makes my work at the Cannabis Council more of a driving mission, I'd say. Also, as a gay man, I come from the heart of Church in Wellesley. I had a film processing business in the 1990s when people in my community were dropping like flies from AIDS, and definitely cannabis in the context of wasting was the earliest medicinal use and acknowledgement that I'd seen. And I could say more, and I'll leave it but to say it was a privilege in a sense also to read the report and to do my best to apply that to the work that I did during my time as Ontario's Minister of Health. And hopefully some of the insights that I have and some of the shortcomings that I now recognize from that time can be brought up as we advance the panel. So thanks to the Commission for sponsoring this, and I appreciate so much a chance to participate.
Absolutely. Thank you for that, George. Indeed, thank you for the Commission for creating the space for us to have this conversation and for engaging in this work in the first place. The initial dialogues, the report have set us up to have what undoubtedly is going to be an insightful and engaging conversation. And I really like already some of the themes that are coming out. First and foremost, acknowledgement of lived experience and living experience, right? Both with cannabis, but also in the different ways in which you engage with cannabis in your personal and your professional lives. So it's part of what's most exciting to talk each time that I do with the people that are on the panel today. So the place that we'd like to start relates kind of very centrally to the work that I do. I promise this is not self-serving. Focusing first on research is not me trying to engender more funds to conduct research on cannabis, mental health, and Black communities, although I would certainly welcome the funds. I plug the opportunity to get research funds anytime that I can, of course. But we want to talk first about research. So in the context of the engagement sessions and came out in the report was most certainly a need to focus on the very topics that we're talking about today. So Black communities, mental health, and cannabis. And, you know, there were some concerns that were raised during those sessions about who, well, first of all, you know, a lack of research in the area, and then who had been undertaking research, who the research was ultimately for, what kind of biases individuals came to research with, and how that influenced like any outcomes that we might see either in the Canadian context or otherwise. So I want to start off, you know, with a question for folks. And again, please draw on your personal and your professional experiences to the extent that you can here. How can Black researchers be better supported to conduct research on cannabis and mental health within communities? And so especially in its engagement with communities in that research. Again, how can Black researchers be better supported to conduct research on cannabis and mental health within Black communities? You know what, I might, I'm gonna like just generally open things up. Having just had a conversation about research with Ike, maybe I'll come to Ike first. We jump off of some of what we spoke about earlier last week, and then I'll go around the panel. But if people have a burning desire, you know, let's keep this as conversational as we can.
Yeah, no problem. I'll start off. So I think, as well as the definition of what a researcher is and who a researcher can be, is can be very constructed and can be misleading. And sometimes there's that misinformation and that barrier, because sometimes looking at community, you're saying, oh, why don't you conduct that research? Oh, well, I don't have enough experience, or you know, it's not the traditional ways of doing research based on our society and the way we look at it and do research. So I feel like that there's a sense of empowerment that needs to be had within communities in order for them to maybe even get the tools in order to know how to do research, because I feel like within our own communities, traditionally, we have our own sense of what research looks like. And it can be simple as going around and calling family and friends and asking simple questions. That's research in itself, but it may not be deemed or titled that within our community. So I feel like there's a sense of empowerment that needs to be had. And even then, it can be also very much community led, is where I'm really getting at in terms of the research, and then supported by institutions and other professionals in other realms that can support community to conduct their own research. Because I feel like there's a lot of power and value in community actually conducting their own research in order to establish that trust and actually be able to translate that information that is made, or whatever that comes out of the research that's done. Because even interpretation of research, when you get those results as well, community and people that belong to those communities are able to interpret it more and better, using a sense of cultural competence and as well as humility in order to get certain findings. So
I'm not sure. I wanted to say this with respect to the research in the report. It really provoked for me, in a sense. I looked back on my time as Minister of Health, and the one thing that really stood out for me is that, in a sense, I could say I got it wrong, which was that we weren't promoting the concepts of race-based data. In fact, and I thought myself as a progressive leader, I was told that it was inappropriate to collect that data, that we shouldn't be prodding at that question. I could look at other things like, you know, black cap and newborn scarlet. I could say, well, very many points in a Black context, I addressed advanced agenda, but really looked at that one and realized that all of the things that Ike spoke about aren't possible if you're not actually willing to have that as a concept. That was the first thing. And then it led me to the practical thing, is like, I worked a lot with Pathways to Education in Regent Park on this model of community succession. And it really asked me to wonder, is like, what is the representation or the relative likely underrepresentation of Black, you know, researchers or people competent to conduct culturally appropriate. And then I did a bit of research on that to see that's a significant challenge also, is that even if we had all of the right things in place, all of the resources and all of the right attitudes, there's an underrepresentation and a dearth of you know, capable community relevant researchers, et cetera, which is, I suppose, an outcome of, you know, a lot of the discrimination, et cetera, which has been central to the charge, you know, the issue of charging people for cannabis possession, et cetera. So this was kind of like, for me, a bit of an awakening.
I love sorry, I just want to go ahead. I love the fact that George tapped on the underrepresentation of Black research in the field to begin with. We can always funnel it back down to systemic issues. The underrepresentation is strictly due to the lack of community resources, which in turn communicates into a lack of exposure into the research field. I always say, if it's not accessible, it's not an option, right? If they don't see it, it doesn't exist. So even just like George was saying, if there's funding, if there's resources, if there's everything ahead in place, but the community doesn't actually know that it's there, how can that be communicated and shown to them that this is an actual option?
So I certainly like all of the places that we've gone. We started off questioning what research even is, right? Like what qualifies as research? And I think, that's a very important question that we have to ask. The point about not only underrepresentation, but around, looking at race specifically. I think as we come out of the COVID pandemic, COVID certainly opened our eyes to racial inequities in health outcomes, right? In a way, as Canadians, that we've been hesitant to examine race and, certainly collect race-based data. I don't think that there's any going back from COVID. So I like that as well. And again, the underrepresentation piece. I certainly have some follow-ups for everyone that's spoken so far. Khadisha, I'll come to you and then to you, Esther. Any further thoughts here?
Well, from the perspective of being a consumer and even a patient since 2020, I didn't really know of any research attempts until even my involvement with this dialogue. And it was almost by luck in some ways, right? That I came into the periphery of, the MHCC. So the researchers, are they connecting with the community at the grassroots level? We're not seeing evidence of that. That would be my confidence. So it has to be remedied. Definitely.
And let me ask you then on that exact point, right? Because in order to conduct research, unless it's observational, you need to be engaging with people. And you've just talked about being a consumer and a patient, right? And so if you think about wanting to encourage and enable research generally, and Black researchers in particular, what would you want to see in terms of, the way that studies are framed and the way engagement happens?
I would like to see actual an inviting of participation with protection of anonymity. The reason being, especially in our community, we're used to being persecuted. In my group alone, we have over 850 members in our online community, but a lot of them are lurkers. They're very terrified that if they like a post or they ask a question, it's going to put a spotlight on them about cannabis. And sometimes they're in fields that they're worried about being judged for it because they want to advance in their career, or they don't want to be judged by parents because they're in that public education, just different things. And there's implications for that if research is going to be taken seriously, they're going to have to facilitate for people to participate.
Okay, thank you, Khadisha. Esther, I want to open things up to you as well.
I think just as everyone has mentioned, I think understanding that there is a underrepresentation and understanding that there's not a lot of research out there. Just as Khadisha said, there's hopping onto this was just by chance that I happened to be on this panel. But I think that understanding that there's more need for research and it's necessary, and this research should be led by Black researchers and has to do understanding that there's a gap that needs to be filled by Black researchers, and creating methods, just as I could mention as well, to be able to empower our community and as well address why is there a lack of this. And we know it's because of systemic racism. We know all these things, and we know that Black folks feel like the research field, the medical field is inhospitable for Black folks. We don't feel safe, we don't feel comfortable, as Khadisha said, like even liking a post or something, like you feel like you're being watched, you feel judged. So I think being able to address that and create spaces where individuals feel empowered to want to get into research and want to be a part of research through being transparent, addressing that there's a need for this, and addressing that it is aware that, it's not always a hospitable space, and working to work backwards to try to work against that, I would say. But I also agree, there's not a lot out there. I think there needs to be more programs. I feel like as part of supporting Black researchers, there needs to be support on creating spaces to empower individuals, Black individuals interested in research, to want to get into research through resources, through programs, through mentorships, fellowships, and such, just to basically create a future where there's more Black researchers. And I think there needs to just be that prioritizing and that focus on Black research and Black individuals going into research to be able to create more spaces for us. And that's what I would say about that.
Thank you very much, Esther. Ike, I hope I'm not putting you on the spot too much with my follow-up for you, but you kind of opened us up with this. In many ways, the research collaboratives with, or even community-driven research gets to, in part at least, some of the key tenets of participatory action research, right? I know that you've engaged in a fair amount of research and specifically around health and Black communities. And so when I say I hope I'm not putting you on the spot too much, do you think you can enlighten us or even share, from your experience, practical or theoretical, what some of the kind of key principles are to such research? So, from the initial stages through to actually trying to implement a research project focusing on Black communities. And if you can say anything about, because it's come up numerous times now, with respect to a stigmatized substance such as cannabis, like what the research might look like in order to help researchers think about the type of work that they would do.
Yeah, no, so a lot of the work that I've been doing right now obviously has been focused on pandemic work. And, talking about substance abuse, for example, has been a big issue as well with pandemic and, coping mechanisms and mental health. And I think the formula, I think the Black community has gone to a point similar to Indigenous communities where it's research exhaustion and fatigue. We've been approached a lot, and I feel like as well as when we send in questionnaires and asking questions and doing focus groups, you're seeing that it's not that our communities don't want to continue with participation, it's that they've participated many times before and there was no outcome of the research. They've made recommendations, they've, wanting to engage with both researchers, politicians, or any people in decision-making positions to make the change themselves, or, to just make comments so that change can happen. And essentially nothing does happen. Nobody benefits from it. If anything, sometimes situations get worse because the issue or whatever that they brought up gets, the situation basically gets worse. Right. I think in terms of approaches is really using, it's a sense of sovereignty and allowing, and I just go back to that empowerment of community and the people that we're approaching. So for example, if I was developing out a project, I would definitely go to individuals or community-led organizations and leaders and ask them, would you like to participate or be one of the lead researchers in this research project? You have the expertise, you have the community base, you have the people that you can be able to establish that trust, and working with them to develop out a methodology that works. I think that also when we're looking at research, we need to start looking at more mixed methods approaches, looking at different types of qualitative research approaches, looking at ethnographic research, and really trying to understand why the data looks like the way it does in terms of the numbers. I think that there's so much value in that aspect of triangulation of data, both qualitative and quantitative data. I feel like our communities have a lot of history that is not incorporated or captured in the research that we're doing. And I would just go with having community lead it. Community has to lead these types of research projects. Our leaders in our communities need to be a part of it. Members of our community as well need to be at advisory positions and be sometimes at that table when we're looking at data and analyzing data and cleaning data for us to actually fully interpret what this data actually means as well. So I feel like that would be the steps and considerations moving forward, is that findings of the research is actually implemented and things are actually done, and that there's a follow-up and consultations, a continuous consultation before and even after the research moving forward. So those are just some considerations.
Excellent. And you started off with something that I'm going to kind of end with, which was just what again, and who is the research for? And this idea, I can certainly say myself, I'm trying to conduct community consultations and engagements around different pieces of work that I'm doing in a way that I've never before. I'm having people, say like, look, we just don't have the capacity, or we don't have the desire to do this anymore. So I think that fatigue piece is really real. Esther, I know you've done some work with the Canadian Students for Sensible Drug Policy. Ashley, I know you've worked in mental health. Khadisha, I know, again, you engage. Specific subpopulations. Esther, if there's any kind of perspective here with respect to research and young people or research and students that you think is insightful, please let us know. Any particular considerations? I guess youthfulness might be an issue. Anything to say about that?
I would say that as far as even at our roundtables, the conversations we've had, a big part of the experience understanding is the fact that a lot of the times it can appear to be spaces that people feel like they're being judged. I feel like there's not a lot of safe spaces, especially for Black youth, There's not a lot of spaces where Black youth feel safe and feel comfortable to have these conversations, especially because mental health and cannabis use are both issues that have been stigmatized for so long, and people don't feel as comfortable. I know, coming from a West African background, we do not talk about mental health, and it is very difficult to talk about mental health even now for a lot of people. So I think a big part of it is being able to create and hold those spaces that are non-judgmental, that researchers could uphold these strategies. How can I make this safe space for young people in the Black community? How can I ensure that there's this trust built between us? How can I create something that people feel comfortable and they want to share and they want to talk about their experiences? And how can I make people feel like I'm not judging them? I think that's something to take note of, because that's something that a lot of people don't feel comfortable talking about and needs to be put at the forefront, that idea of safe spaces.
Excellent. Thank you. And I'm going to come to Ashley and Khadisha before asking a final question of George. So Ashley, go ahead.
I just want to add on, I really like what Esther said, building safe spaces. And with building safe spaces, you have to understand who your audience is, right? And understanding that the Black community is not a monolith. We're not all the same. We don't deal with all the same issues. So, when there is structure with regards to your research, looking at targeted campaigns to allow a variety of discussions with different segments of different people who have different experiences, I think is also critical. Let me give you a couple of examples. There's English and French speaking Black people, right? If we're looking at the scope of faith and religion, there's Rastafarians, there's Black Muslims, there's Black Buddhists. How do you approach those entities and actually speak to it? And let's talk about the big elephant in the room of those individuals who have been jailed for cannabis and those who have not. So when you're taking a look at the spaces, it's really the framework and how you're approaching it and where those experiences are coming from. So that was just a pinpoint that I wanted to add.
Thank you for that, Ashley. And I hope people are hearing when I talk about Black communities that I'm saying communities instead of community, an exact acknowledgement of the point that you've made, Ashley. I think that's something very, very important to consider, that the Black communities in Canada, the Black communities in Canada are not a monolith. I'm looking at the time. I'm going to ask a final question of George. I did want to, and maybe you can incorporate both for Ashley and Khadisha. Just thinking about, we're talking about creating safe spaces, and I know again that you have either worked frontline. Ashley, I know you worked in the space of mental health for quite some time, and Khadisha, again, you're engaging with people. Any more about kind of the creation of that safe space? But I let's just pause that, because I think we can bring that back. And I just want to ask a final question or point here of George, as someone who undoubtedly leverages research or has leveraged the research in your work. So I'm thinking, certainly as health minister, and then also in your role now, right? Like, you need to leverage research to lobby government. What can Black researchers be thinking about, and what can we think about generally in the area of cannabis, mental health, and Black people to create research knowledge products that not only speak to the communities that the knowledge was drawn from, but also can be impactful at policymaking tables and for decision makers?
Oh, I don't know. That's such a hard question. I was still back processing what I learned from a prior comment. That's how I find my life often is I'm processing a couple of comments back, and I wanted to identify with that slightly also just on the just on the building safe spaces thing. For me, so much of this is, and communities versus community is so familiar to me from the standpoint of my, presence within the LGBTQ community. But I'm so old, I just say queer. Like, I can hardly keep up with all of the differentiation that that comes. When I was thinking, well, what's the challenge for the state? Like, my role as an industry leader in a sector that's part of a community is like, my objective is like, my responsibility is try and make the whole sector a safe space in a certain sense. Like, and this is, I know some of the work that Ashley and her brother have been doing is to actually not just, I'm thinking like, how do I help to create the conditions for that safe space that isn't just about asking people questions like, how is it going, but also showing them like the other parts of the equation, like showing the access to the opportunities that, that should come. I would just say that in an environment where you're trying to get change, and that, back to your bigger questions, like the environment. I spent my whole life working in government, like in and around politics and government at one level or the other. The level of the complexion of the government models that we've created means that absent of good quality research or research which can be made to be kind of appealing and noteworthy, you lack the prospect of differentiating your issue in a way that you need to get attention for change and for movement. So absent of it, the prospect of successfully getting people to alter course is very, very unlikely. So I don't know if I've hit the nail on the head, but I think as an essential ingredient to differentiate your issues to successfully get attention. So to take the research, I'm like, how do you apply that? How would you apply that research to affect change? So absent of it, you'd be screwed.
And I think that's a very important point of this, right? Otherwise, as an academic, the last thing I want to do is research for the sake of doing research, right? There undoubtedly, we hear about these ivory tower types who sit in their ivory towers and just do research to publish papers that no one else reads, right? And for many of us, and I think there's certainly a shift in the academy towards more practical in the social sciences and humanities, as well as, of course, like the STEM fields and others, to research that's going to have an impact. Otherwise, why do it? And so, what I'm hearing here, I've heard a number of things here, but certainly, of course, engagement with and utility for usefulness, speaking back to the communities and speaking with the communities from whom the research findings have been drawn. So taking them along if they're not leading already, or having them lead the process, but ensuring again that timing, format, whatever it might be, is right for it to have actionable kind of consequences or be actioned on. So this is excellent. I'm gonna have us just kind of switch gears a little bit, because the having impact and education are closely related to one another. So I want to move us on to the area of education. All right, and we heard and we talked about informing and educating Black communities about the relationship between cannabis use and mental health. And we heard a lot of different things during those engagement sessions about the relationship between cannabis and mental health. Of course, anyone that's watched Reefer Madness or seen any drug propaganda will have undoubtedly been made to believe that cannabis use, even minor cannabis use, can lead to serious mental health problems. There's certainly research demonstrating that early onset or early use and early use of high THC products can bring underlying mental health problems to the fore. And so there's certainly a connection between cannabis use and mental health. And we also heard a lot of people talking about using cannabis to deal with mental health problems. So the opposite, right? When we think about race and racism, and we know that the experience of racism can lead to it can be traumatic, and so people using cannabis to deal with trauma generally, and perhaps racialized trauma in particular. But there was certainly a feeling that there was a need for, again, kind of more and better and certainly culturally appropriate education. So From your perspectives, as people again who certainly educate, because I know most of you from educational forums, whether depending on who educating different constituent groups, what are the mechanisms needed to build capacity, first of all? So what are the mechanisms needed to build capacity for education and knowledge transfer within Black community organizations and amongst trusted community leaders? So if we think again, we got people on the ground who are connected to large groups of people, so people working within organizations and especially trusted community leaders. What are the mechanisms needed to build capacity for education and knowledge transfer? What do we need to do to help just generally educate Black communities around the connections between cannabis use and mental health, and how can we empower people within those communities to do that? So again, no small question. George was ripping on my last question with the big questions. This is a big question as well. And I really appreciate in our last kind of portion, people picking little bits that kind of relate to their experiences or the work that they've done. And please feel free to do the same here again. Esther, if you don't mind, I'm going to start with you because of course, and I've been engaging recently with Canadian Students for Sensible Drug Policy, you do a lot of education, right? And not only do you educate, but I think you empower others to educate too. And so if you can perhaps speak to the question, some of the best practices and what's needed in this area, please.
Yeah, I think there's actually two pieces that I see this. I think the first thing that I always see and we talk about in CSSDP is the idea of actually reaching out to these communities and asking them what their needs are with regards to education and transfer of knowledge. I think the best way to support a community or provide tools for that community is to ask them, what are you lacking in that space and what do you need essentially? And this can be done through a few things, like for instance, we do our roundtables to get feedback and to see what people need and have those conversations. I think another piece of this is to specifically using or working with community leaders and working with Black organizations is reaching out to young people and providing spaces that can mentor young people through things like paid fellowships and cohorts to be able to become individuals who are change makers, who are other young community leaders. I think that that's just a big part of it, is creating spaces for people to talk about what they need and what we want, and then creating programs that can benefit young people and educate them on mental health, on cannabis use, to be able to educate their communities as well. I think that's probably the biggest piece to it. I think it just really has to do with finding out what the need is for and reiterating back to the community and working with young people, because young people, like everyone says, young people are the future. And I agree, because we're an influential community and they go based off the way we influence people and the way that we're influenced. So I think it needs to be a community-based work. I think that education should not just be one person educating a whole bunch of people. I think it should be together. And that's pretty much the way that I see that.
It takes a village to educate a child or an adult, I guess, eh? So thank you for that. And certainly insightful. And, the first part, I think of what you said, well, you're acknowledging, again, heterogeneity or difference within communities, right? And so there may need to be, this is going to be a common theme, right? Like different forms of education and different information shared for different parts of any given community. So most definitely. And then assessing community needs. So I think that's great. Thank you. Khadisha, I was going to come to you next anyway, because again, I know that you do a lot of educating, formally and informally in this area. And so please, over to you.
Well, I'd love to build a bit on that. Thank you so much, Esther, for the comments and the emphasis on educating younger people. And statistically, younger people learning about cannabis properly would be a challenge, but they definitely know about cannabis. I would actually direct attention and resources to teaching the older people, because the older people are the ones who are controlling our access to cannabis and our access to cannabis education, if we're being honest. Even from the levels of wanting to study in cannabis if you're young. If you go to your parent and they don't understand why this plant is legal, you're never going to get them to pay your tuition to go to school in a cannabis program. You're not going to get them to underwrite your business enterprise in the cannabis industry. Legalization was a great first step, but we still have to educate older generations on destigmatizing the planet, the plant itself. So I would love to see us enable and empower local organizations to connect different community demographics, like older women in church with cannabis plants. Let's educate our mothers and our aunts on the merits of topical cannabis and teas, and because nobody's doing that, right? And it's not going to get done by itself. And so that would be one of the ways I'd also like to approach the gap of education for our community, and also create further pathways with the healthcare community. A lot of us are afraid to talk to our doctors and healthcare providers about our cannabis use. And it's imperative they have that knowledge. When you're going to get a dental procedure, it helps if they know that you use cannabis, or you're getting a surgical procedure. So there's a lot left to do that we can hopefully pick up the mantle and try to work on together, but it's a lot.
Khadisha, thank you. Ashley, I see you nodding away there. Please go ahead.
I want to second that sentiment with regards to the elders in our community. I think most of us in here either have an elderly person in our family who we're taking care of, or we're part of that sandwich generation. And a part of us understanding what cannabis is, most of the time, came from them, whether it be negative or whether it be positive, right? And we also have a demographic of seniors that are getting a lot older. Those baby boomers need to absolutely understand not even just how to approach the topic of cannabis, but as well how to utilize cannabis for their own health. So that's segmenting into the elderly population, but as well the medical population. Absolutely, the youth needs to be aware of not even just how to use it, when to use it responsibly, and the opportunities that work within the industry. But as you can see, whether it be from young to old, there's a spectrum of individuals that are there that we should be educating to actually get this stigma removed from cannabis so that we can truly take in all of the benefit that the plant is giving us.
Thank you, Ashley. And George, I see taking notes, and Ike perhaps too. I want to open things up to both of you. I don't know if either of you have something you want to say about this. George.
I was just capturing, well, I was really struck by the strength in the report of the commentary about challenges even in that people have in communicating with their frontline with docs and such. And it really is an overall, that really is a challenge that we have overall, which is that the medical community, the Canadian Medical Association, not easy adopters, let's say, of a non-DIN number, the idea that something that doesn't have a DIN number can be a medicine. And that's a challenge, and maybe that challenge is even more deeply personified in some of the communities that are that we're speaking about here. So to me, it was about the challenge of being able to find both that culturally appropriate, the trusted voice who's also culturally appropriate, like segmented by community, that in terms of trying to do that education, I circled back again, is like, well, who's going to do it? We've got this dearth of individuals generally, and then maybe more particularly. So I think really it's one of the things that, for me is like a piece of homework. Well, what do I do about what I learned today is to start to try and build, in a sense, the supportive portfolio of healthcare practitioners, and then kind of look at them so we would say they're trusted voices. They all have the potential to be a trusted voice, and try and figure out how to deploy them on a culturally appropriate basis. And to talk about cannabis beyond just mental health, but, for anyone over 55 or 60, for the CBD impact that it might have for their, for their aching joints and such. So I don't know, I'm still, processing those things. And one other point is, within cannabis, there's always a big divide between, there are certainly people that can talk about studies that show efficaciousness on an indication basis, kind of characterized in the way that the medical community is used to seeing it. And there's other people in our community that will just profess that cannabis is good, has no possible side effects and is only, is only 2 thumbs up, etc. Like there's a certain amount of that, obviously, which is always proselytized by fellow consumers, like it's a miracle plant. What do you mean? It's for everything, etc. So we have to also like try and make sure that we've got those trusted voices with that are well informed with clinically justifiable data or what have you.
And I think that just, I'm going to, Ike, I'll come to you in just a second. I think, and this is my bias coming from the GTA, I can think about many of the great organizations that are doing frontline health related work with Black communities that would be ideal to be the conduits to these forms of information and education, right? Again, we saw the great work that they were doing kind of throughout COVID to dispel myths and engage people with respect to vaccinations. And there's certainly a robust network of folks. I'm seeing in the chat again, certainly people with some concerns, Black frontline healthcare providers about the consequences that may come to them for example, prescribing and the advice that they give. So most definitely concerns. Ike, any final thoughts here?
No, I just wanted to piggyback. I was about to say the same thing as George, as yourself as well. So I was taking notes, but it was like engaging over the pandemic and even before the pandemic. I've done a lot of work in sickle cell disease, for example. And as someone who suffers from fibromyalgic pain and chronic pain, I know the benefits of cannabis. And I've had to actually do my own research to know like what is the ratio of CBD to THC, the cannabinoids I should be taking. So, and it's, I guess I'm lucky and fortunate that I have that background where I can understand clinical studies and do that. But there's a lot of people in my community that don't have those types of skills and aren't equipped to really understand and interpret what the information is saying. And yeah, so that was 2 points in one, but that is one point where it's like, we need that knowledge translation and equipping our communities with the ability to understand that type of science literacy and health literacy, which was a big thing that came out of the pandemic, where it's like, we realize that Black communities actually lack a lot of health and science literacy and understanding information in the way that it's described in terms of clinical, jargon, et cetera. Medical jargon, et cetera. And going back to the sickle cell point, it's a fact that a lot within our Black communities, we suffer from a lot of different disorders or diseases like sickle cell, and people not recognizing that cannabis can be used to support. And it's again back to the stigma. It's back to our Black physicians, et cetera, that have that, that are afraid to talk about cannabis or, even wanting to do research on cannabis. I've gone into a lot of spaces where I'm like, hey, maybe we should consider, cannabis for sickle cell disease and, helping to aid with mental health. And it's like, yeah, we'll talk about it another time. We're going to, stick to narcotics. So it's those types of conversations that need to start being had, and that information and disinformation, and arming our communities with the information that when it comes to these types of conversations and they're in these circles, they're able to actually be able to be ambassadors for the plant and actually give credible information. I think those are the steps to education within our community.
This is excellent. I wish we had twice as long for the discussion as we have this afternoon, but I guess we'll just have to do a part 2 at some point in the future. Thank you very much, everyone, for your insights so far. I want to allow us a little bit of time for refreshments, reflection, and whatever else we need. We have a 5-minute break scheduled in our agenda. We're going to pull up Lisa's wonderful work so it can be profiled here. This is so neat. I can't draw a stick man, so let alone try to follow on with the conversation and produce a graphic. But we're going to pause for 5 minutes, folks. I have 1:53 on my clock, so I think we'll come back at 1:58 for the final section and then the Q&A. And if we can highlight, I think we are now, Lisa's work, that would be great. So you got 5 minutes, folks, to get up and stretch your legs, use the restroom, get a drink if you need to, and to have a look at what we have produced for us here. So thank you, and we'll see you in 5 minutes. All right, folks, if I can welcome us back, please. Excellent. Just I've got Ashley, George, give Esther just a minute to come back. There we are. Wonderful. Lisa, really great work. This is so cool. I'm going to invite you to some of my course lectures. I think my students would appreciate it more than the written notes that they take.
Oh, thank you.
All right, folks. So I want to move to our last section before we go to a Q&A, and I certainly want to leave ample time for Q&A. So George made mention already of the review of the Cannabis Act, which should be underway, the legislative review of the Cannabis Act, which will be, looking across different areas at the impact that cannabis legalization has had on Canadian society, Canadian people, health, economy, et cetera. I want us to think, just kind of generally, what we'd want, policymakers to be thinking about in using research drawn from Black communities around cannabis and mental health, how that research may best be utilized and how it might best serve Black communities. And then, in relation to the review itself, what folks on this panel would like the federal government to be thinking about as it reflects on what the last 3 years of legalization have done and how it may have or have not impacted or not considered an impact on Black communities. So two quite general questions there, but first of all, how can the research and education be leveraged by policymakers and what types of things should they be thinking about? And then specifically around the Cannabis Act. I could pick on George as a policymaker, perhaps first, insights from the policymaking world, and then open things up from there.
I think I'll happy to take a shot at it. I think in a certain way, I could say anybody could that people posing questions of Health Canada in the second part of your question might well also pose that at me in many of those questions posed in a hard way to Health Canada. I recognize might justly be pitched also at those of us in the industry and the sector, because every report that we've seen on diversity and inclusion, including gender inclusion, we're not exactly living up to the social ideals that certainly are very embedded, as an example, in the conversation about legalization in the United States. We have to reflect on sometimes the fact that our legislation was underpinned by some public health objectives, and that could mean sometimes that Canada's legalization and Bill C-45, for all of the progress that it represented, doesn't have the embedded elements of progress like many of the legislative initiatives in the United States. And now but I just say to anybody in our sector, evaluate companies on an individual basis. That's more than fair. Call attention to deficits that might be there, but we are a young and yet nascent industry. So I choose for us not to be defensive about it, but rather to use the research that's out there to pull up our socks, to improve our game, to fulfill more of that social side objective. To answer your kind of the one thing I would say that I think draws that everybody ought to be aligned on, that I would really call attention to, is that the government of Canada and Health Canada were very proactive, and they should be well regarded for the courage and the work of legalization. That wasn't a small effort, and it was courageous in its place. But they have not taken the opportunity that a legalized environment and framework creates to be creative in their education role, not within cannabis, educating people for safer means of consumption, where 60% of all the sales are in dry flower, and certainly not, as an example, taking stock of the opportunities to use quite a bit of financial benefit that they've achieved to do more of the kind of education and things that we've been highlighting today. So in a global sense, we think that's an area where Health Canada should say, They legalize, but they're still stigmatized. And so is the whole government. And really, they need to be convinced, I think, encouraged to play a bigger role as educators and as financial contributors to the education around cannabis.
Thank you very much, George. Ashley, I see you nodding. I see you smirking a little bit. And I know that you engage with policymakers as well in various parts of the work that you do. So, what do you want the policy making world to know right now about cannabis and Black communities?
I love the point that you made, George, surrounding the fact that government has the ability to actually put dollars in front of education. Now, everybody for the audience, I'm a part of C3. C3 is the Cannabis Council of Canada, and they're the main lobbying group for the cannabis industry. And there was an actual proposal for regulatory research that just was released, and George, please correct me if I'm wrong here, and it focused on the non-therapeutic research on humans, okay? So the focus is strictly on effect and onset and the adverse impacts of cannabis. Now, it's coming from a perspective of how to keep Canadians safe by letting them know about some of the challenges that comes with cannabis. But how can we change that lens? And this is just an example of what potentially policymakers and researchers can collaborate on when we're looking at cannabis and what is another way of looking at it. So for example, could we start putting our research dollars in front of what are the positive impacts of cannabis and mental health in different communities? And how do we use it responsibly? That is a point of contention when it comes to education. Another one, simply because I'm a grower and I am curious about this, is the genetic selection. The genetic selection that is currently in Canada, for everybody else, it's the seeds, how that actually impacts the mental and medical aspect of medical patients. That's huge. Can we at least have a discussion about the endocannabinoid system, how it works, and how individuals have the ability to make the right decisions for their own bodies? Again, equipping the Black community, other communities with the ability to actually have that knowledge to make a calculated choice. And can we also approach this from a holistic lens, looking at this through mental, emotional, physical, and spiritual? Because when you're dealing with different communities, sometimes they look at health in that type of lens, in that type of perspective. So as much as we do have to do the research on some of the ailments that do come with cannabis, we also need to take a look at the other side of things, and by actually looking at the positives surrounding cannabis and how it can benefit us as humans.
Excellent. Thank you very much for that, Ashley. Esther, I want to come to you. I'm thinking from, again, the work that you've done with the Canadian students on sensible drug policy, from the student and the youth perspective, what are some of the key things for policymakers to know? One of the underlying goals of the Cannabis Act was to protect young people, in a number of different ways, health-wise and social-wise as well. Is there any kind of insight that you can provide from the youth perspective?
I think I would say, I think I see this kind of to what we discussed previously about how there is no single Black community. I think that especially in young people, there's a lot of different communities, a lot of ways that in different communities that cannabis is used, and a lot of cultures use cannabis for different reasons. And I think that particularly to the youth experience, it's important to take note of that, especially because there's so much knowledge about use. And I feel like with regards to young people, as I mentioned multiple times, a lot of young people just feel like their opinions are not important, especially their needs for use and things like that aren't important. So I think a big thing here is to amplify those experiences, amplify the fact that young people use cannabis, the fact what they use it for, the fact that there's different communities of young people that use it for different reasons, specifically with regards to culture. Black people exist everywhere, specifically with regards to religion, because there's a lot of religions that fall into cannabis and some religions that are not in support of cannabis use, but individuals still exist in that religion and need support in that way. So I think understanding the intersectionality that exists in cannabis use, specifically for young people, is really important, especially because young people are not feeling like they're being heard, and there needs to be that amplification of the voices of young people with regards to cannabis use and mental health. So.
Excellent, thank you. And so, I'm thinking of the context of the review of the Cannabis Act. One of the key pillars, again, being protecting youth, acknowledging, as we said, with Black communities, that there's heterogeneity, that there's also great heterogeneity, of course, in Canada's young, right, amongst Canada's young people. Ike, Khadisha, any thoughts in the policy realm, considerations for policymakers around the issues that we've been speaking about? And again, they can be general or specific to the review of the Cannabis Act.
I would actually like to highlight the lack of social equity provisions in the Canadian Cannabis Act. We've got regularly announcements coming out of different states, including, as recently as New York State. And with their social equity provisions, part of the movement, or one of the things they built in, was offering licenses to people with past cannabis convictions. I think we have to look at the optics of doing that, because the image of the plant has to be rehabilitated somehow. And if you're actually going and actually expunging, rather than just making them cheap, but expunging cannabis records, and actually we're like putting and building in social equity provisions, then that helps to change the mindsets of older generations that have been preconditioned to be against it, or not even to be willing to learn and understand it. So looking at like jurisdictions like Colorado, where yes, they legalized early, but they then did a revision and built in, or did an amendment with social equity provisions. I'd like to see something like that happen with our policy coming out of the next review.
Excellent. Thank you so much, Khadisha. George put his hand up. I'm just going to go to Ike. Just quick. Any thoughts here, Ike?
Yeah, no, I think in terms of policy considerations would be race-based data collection. I know we say it all the time, but I think it was the most, like, I had an epiphany the other day in terms of like looking at research in Jamaica, and they had numbers. And when I saw the numbers, situations made sense. And I sat there and it just became more real to me. And I think that is what's missing as well. And if there needs to be an emphasis in collecting license holders, how many license holders, in terms of subgroups and some, and looking at that and actually understanding, even when you consider like mental health, like the beauty about this research is that it's Black focused. So you're actually getting an intersectional approach to it and understanding it more, so that we can be able to better inform and move forward. Other considerations are, who are the policymakers and who are the policy writers? Are they diverse? Do they actually understand the communities? Do they understand cannabis? What are their backgrounds? I think that a lot of people are just being pulled into the policy writing realm and they actually have no connection or understanding of the cannabis industry itself. And also, I don't know if I may be mistaken, but what evaluations have been done on the policy as of yet, like actual formal evaluations of policy? How are we going to be moving forward and changing policy without no formal evaluation of what the outcomes, the goals, or anything, the impact it actually has made on community? And maybe that from a federal level, provincial level, municipal level, whatever level it is, but there needs to be more formal evaluations of the policy impacts before we start writing policy and changing policy, because essentially you're going to continue changing policy and nothing's going to it's not going to benefit anyone, which we've seen for the last 3 years. So.
Excellent. Thank you. George, I know you wanted to say something. If you can say it in 30 seconds, go ahead. Otherwise, I'll move to Q&A.
What a challenge. I just wanted to actually identify positively with the idea that we should look for social equity provisions, but just to remind one thing crassly, in a sense, and Ashley knows this picture all too well, there's a lot of licenses that have already been given out. And getting one of those today is to enter into a very fraught and challenging environment. And the provinces got all the money. That's the only other thing to remind, is that a lot of the money, that excise tax went 75% to the provinces. So we think a lot about Health Canada because of Bill C-45, but in terms of trying to influence policy, promote education, and get adequate access to resources, the provinces have a lot of this dough. So I just want to kind of put that on the record.
Thank you. Thank you for that. All right, folks. So this is, again, wonderful discussion. I'll do a little bit of a recap at the end, but I want to move to the Q&A. Audience members, thank you very much for your insightful comments. I've been trying to read as well as listen to the panelists at the chat, and I really like what I see in the chat. So thank you for engaging in the way that you have. There are a number of questions here. I'm not going to ask them in order. I'm going to start off with one around kind of young people, and then I'm going to move around a little bit. So we've talked a fair bit about young people. We've talked about the stigma of the plant, and we've talked about different kind of types of use. And so we've got a question here from Amira. How can we speak to young Black folks about the difference between engaging in cannabis use for its beneficial purposes, especially where mental health is concerned, and unhealthy dependencies on cannabis? How do we bring harm reduction and trauma-informed approaches to this conversation? I don't know, anyone here wants to start?
The one aspect that I would just like to comment on is broadly to support the concept of Health Canada and others playing a more proactive role in education. We've already covered that, and I want to put thumbs up regarding that. Again, that's a mandate that they need to take on. We will be articulating that one of the key challenges that we have within the context of the current regulation is the inability to convey very much information to our actual consumers within an appropriate age-gated environment. So in support of the idea that we're not really very able to convey characteristic information, etc., we want to improve that. But in part, like I said before, from a harm reduction standpoint, we have a really, really large portion of our consumers that are consuming dry flower. Me too, sadly. And someone should be encouraging me to say, hey, Mr. Smitherman, nudge, nudge, wink, wink. We know it's legal and you like it, but have you thought about altering your consumption pattern towards something that didn't actually, like, perhaps, affect you more negatively? There's no opportunity like that that's being taken so far. So that's harm reduction.
Thank you for that. And the harm reduction, especially again around something that's been stigmatized and glorified, right? When we think about young people, there's certainly glorification of cannabis use in various forms of entertainment and media, right? Whether that be film, whether that be music. So I don't know, like Esther, I'll look to you a little bit again, just because of your work with Canadian Students for Sensible Drug Policy, but anyone else that wants to, how are you, and Khadisha, put your hands up, I'm going to go to Esther and then Khadisha. Like, how do we have these conversations with young people and do it effectively? We're not going to stop them necessarily from using. So how do we have them do it in a safe manner? Safer manner?
I think that this is a really important question. Specifically, I was thinking about the fact that a lot of the time when I've done work with survivors of gender-based violence, they've expressed that they use cannabis to cope. And I always talk about, make sure to understand the difference between using it for your mental health and using it to cope or to repress whatever you're feeling. And I think that's an important part of it. I think that this is very touchy, especially because of that difference between, am I using this because I have anxiety or because I have PTSD, or am I using it because I want to be high and not want to think about all the trauma that I've experienced? So I think a big part of this is being able to have spaces where conversation needs to be had, because people don't know. And just as somebody who was that person who eventually realized that I was using cannabis because of just wanting to cope, I think it's important to create space for people to identify that. And that is honestly the best way to do that, is through conversation, through making it aware that these are the benefits of cannabis use. But you need to understand that there are ways that it can transform into using it for to cope, or to just not have to think about what's going on in your life in that present moment. So I think for me, the best way to do it is through conversation. I feel like there's education out there that needs to be happening as well. But I feel like when it comes to trauma, I think the best way is to hold conversations, hold spaces where conversations need to happen, to have these conversations about what exactly is your use? Why are you using it? And how can we shift the dynamic of this use? And how can we make people more mindful about what they're using cannabis for?
Excellent. Thank you very much. Khadisha, you were going to say something there as well.
Yeah, I love those ideas, like what you were saying, Esther. And to build on that, thinking back to a long time ago when I was, a student in college. Obviously, it wasn't in this time period, but opportunities, with student services departments and, different trade booths, there's ways to get information to our youth, and also other ways to show them, to educate them on using cannabis with intention. Because if we're showing them the different ways that people use cannabis with intention, then that's going to encourage them to explore the why they're using it. Are they using it to get high because they've had a busy school week and they want to let go, versus are they needing it because they're about to go into an exam and their nerves are like flying. And that's the difference between telling someone, okay, maybe you don't want something with those type of terpenes, but you want something with maybe pinene or limonene. Like, there's so many educational opportunities that have not been explored because all we did was legalize it. We didn't go and destigmatize and educate. So I'm actually hopeful that we can do more, and we can get in contact with the different youth groups on campuses. And, I was president of one myself back in the day, and create those safe spaces. Maybe it's yoga in a multi-purpose room, or meditation in cannabis, but talking about it and using it with intention. I think there's great opportunities that we can bring to the youth to help with that, and to help people identify, therapeutic intent.
Excellent. Thank you. So there are a number of questions. I'm looking at the time. I'll probably summarize a few and make some suggestions at the end. One of the things that's come up again, and a lot relates to stigma. So we've got how do we conduct research with populations around mental health who may have also been criminalized? There's two parts here. I'm going to put two together. So how can we engage communities and individuals who've been criminalized for cannabis related behaviors in research around cannabis? And then the second one, which is distinct but similar with the stigma, is, given that patients may be concerned about losing their doctor by telling them about cannabis consumption, how can we reduce stigma in the medical fields? So those are two different questions, but I'm putting them out there because we've only got 5 minutes left. I'm going to open things up to everyone and answer one or the other if you would like, and neither if you don't want to.
May I just touch on the question regarding individuals who have been criminalized or maybe jailed for cannabis, and how to have a discussion with them? The harsh reality is they went through a very impactful trauma if they were to be criminalized. And if they're also dealing with mental health issues, which goes hand in hand, to be quite honest, it's really about addressing the situation and having an open communication, so that, again, creating a safe space so that they feel comfortable enough to allow those conversations to be had. There are ways that community groups can approach that, but I do have to put the onus on governments and politicians to actually have those difficult conversations, because it wasn't community that put them into those spaces. Those individuals were put into those spaces because they were utilizing the exact same plant that people are utilizing right now.
Mm-hmm. Mm-hmm.
And there has to be a difficult conversation that needs to be at the forefront if we are collectively trying to heal this side of cannabis and heal relationships with government and different communities of color. It's a hard answer. It's a straightforward answer, but it's an answer nonetheless.
Thank you. Anyone else?
I just wanted to say, from the standpoint of my industry, two things. The first is that we're going to work in trying to use the amnesty, which should be expungement, and I won't explain all the reasons why they won't or say they can't. Well, we'll seek to try and use that as a bridge to parliamentarians. And that's something I've been talking to some of your colleagues about. That's a natural point of alignment. The second thing is, with respect to the questions like how do we actually position this to deal with the stigma of medical practitioners, my industry association has a lot of obligation, I believe, also to elevate or re-elevate medicinal cannabis, which has been largely shut out due to the adult rec legalization. And part and parcel of that is to create the capacity to convey more information backed by research on cannabis in forms and fashions which those medical practitioners are used to receiving it. And to that end, we have an affiliate member that's led by a woman who once was the Ontario Drug Secretariat leader, Helen Stevenson, and she works, on trying to actually create for medical practitioners prescribing guidelines using cannabis based on, and it's not the whole ball of wax, but that's an example of a tool that I think we could deploy more effectively to try and bring more practitioners into the fold. That's kind of where I started in this conversation. Is one of the obligations that we have is to try and create better conditions and information to create more sympathetic circumstances and better informed practitioners. So that's part of my learning and part of my responsibility.
Excellent. And I have to, George, I'm not going to ask you to respond to them necessarily. I certainly agree with where the question poser is coming from. So maybe there'd be recommendations coming out. There were two questions focused on industry. One was around like the facilitation and funding of basically help facilitate research around cannabis and a variety of different things. And then the second part, you just spoke to inequities and amnesty. What else can the industry and industry associations like yours do to facilitate greater inclusion? We're at the end of the panel. Those are two huge questions. What I will say is I would like to see your association do more to foster inclusivity in the industry and do more to facilitate access to materials and funding to carry out research. We can have we should have a full panel on those things. So I'll pause that there. I do want to just, for folks that didn't get a chance to answer the two questions, and I got you, Khadisha, I'm not sure if you want to say anything or any last final thoughts from anyone on the panel before, unfortunately, I wrap things up because we're getting close to the end of our time today.
I'll just add one thing in terms of Black physicians and stigma. I don't know if anything has changed, but within medical school as well as pharmacy schools as well, the integration of cannabinoid research education needs to be there in formal training, and as well as additional training for even students in biomedical pre-med programs, etc. That should be also included in curriculum. I don't think it has changed since I've been in undergrad, but if it has, then that's a step forward. But moving forward, there should be that integration of cannabinoid research and education in curriculum for both medical school, pharmaceuticals, or anybody who's giving, in terms of medicine. And that's my final thought for that question.
Excellent. Thank you. Okay, folks. This has been an excellent and engaging conversation, and I'm of course not surprised because we've got a wonderful panel with us here. I'm looking at the work that Lisa has done, and it's a small square on my laptop, and so I look forward to seeing this final product in a larger format. I'm going to kind of finish off with some statements that I made opening the report, the forward to the report, and think about that in the context of the conversation that we've had today. So I write at the beginning of the report, looking back on the dialogue sessions that we held, 3 points stood out. First, to develop meaningful knowledge about mental health, cannabis, and Black communities in Canada, people's firsthand experiences need to be part of the conversation. And that's come out very clear again in the conversation that we've had today. And so the people whom research is being done, and we've decided not on, but with or by, need to come out very clearly. Experiential data is key. Meaningful knowledge about mental health cannabis in Black communities is most definitely important. We have huge gaps in our knowledge base, and we know that stigma underpins some of those gaps. And so we need to, and my hopes is we're just a few years past legalization, that stigma will start to abate. And again, very clearly, Black communities must play a vital role in leading and collaborating in the production of research. And importantly, research findings must flow not only to policy and decision makers, as we've discussed, but back to those communities to help fill some of the gaps in education. I noted in opening the report that I hope that report was shared widely. And given how accessible our conversation has been today, I really hope that the recording of our panel will also be shared very widely. And so I encourage all of the audience members and of course the panelists as well to share what we've created today through your various platforms. On behalf of the Mental Health Commission of Canada, I'd like to again express my great gratitude to all of the dialogue participants. Thank you very much for being open, being candid, and engaging in the way that you have, and sharing your expertise and your insight and your experiences that form the basis of the work that we continue to do here. Thank you for your time for this conversation. A special thank you to Afro Canada Budsistas, who were crucial in providing key inputs that made this event possible. And again, to the staff members at the Mental Health Commission of Canada and to the various funders, Health Canada itself as well, for making the work that we're doing and the products possible. And to the attendees, thank you for being here with us today. Thank you for listening. Thank you for participating. And my hopes is that we're really, just carrying on. We're beginning these conversations, that we will have many more of them to come. So please do share what we have here, share our recording, share the graphics, share the insight that you've learned. And I'm sure I can say this on behalf of the commission and certainly myself, circle back with any questions, comments that you might have for us. I'll say goodbye to everyone. I hope you have a nice afternoon, and I hope you have learned a lot from our session. Take care. Thank you.